to gina-avoid ta kaysa mag-step kay sakit. So gamay lang a step and then we step with the good leg. So that's antalgic gait. What else? If we have injuries, minor or major injuries sa leg, if we have operations, if we have knee pain, mga amo lang gid na siya nga cases nga daw magka-problem kita sa gait. But aside from that, usually normal man yung gait pattern na. Kaga mo pag genetics, di ba may iba na siya nga, like they were born with ang bow-leggedness bala. It comes with their genes sa family nila nga daw bow-legged ang shape gid sang legs nila. May iban man nga sa genes man nila nga daw most of them have may ginovalgum nga appearance ang leg. So take note niyo na siya. Actually, mga ginovalgum sa postural eval, mo na siya, di ba makita na? With gait, ya kayo nagalakat na gin mo. Sige. Independent standing. Sige. Dynamic base, foot angle, ang makukagina, toe out, the amount of toeing out and toeing in. Cruising. And then here, the bipedal walking. So again, it starts from when the child is walking in a high guard position, arms in around 90 degrees of abduction, flexion, and or forward flexion. And then as the child goes, naganubo ng iyang high guard position, naga-narrower ng iyang base of support, and then naga-attain, the child already attains the reciprocal arm swing. And then naga-develop na siya good postural alignment, a narrower base of support, a neutral pronation and supination, and then naga-progress na siya in the next 2 to 4 years. Again, pivabda means pronation of the foot or of the ankle. It's composed of 3 motions. So pronation means eversion of the ankle, eversion, pivab, abduction, and dorsiflexion. And then pronation, supination on the other hand, composes of sinadpa, inversion, adduction, and plantar flexion. So, pivabda and sinadpa ni anak mo madula. Forever na. Ako, college, kung naman natutunan na ang teacher na mo do. Ara na lang siya sa subconscious mo. Hindi nag-message mo, teacher, tan wala kami classes sa hapon. Wala. Sabi ko, sige. Sige, so your cadence, gait velocity, step length, and true run. Just some of the assessment tools that you can use. Again, damo-damo man siya assessment tools, but these are just some of the assessment tool. For example, if you have a child nga gin-refer na sa imo at age 7, for example, and then ga walkman, so you can use this sa imo nga example sa O muna ba lang nga part, sa objective part, so gait assessment. So you use the GMFC system level. So you assess the patient as having level 3. So pwede mo man siya magamit. So here, gait with cerebral palsy, kaya mo nang balinis na din ako na ma-focus. So the prerequisites of normal gait in the order of priority are should have stable lower limb in stance space, and clearance of ground by foot in the swing phase. So ano nino namin end with? Proper positioning of the foot in the dorsiflexion in the terminal swing, and adequate step length and maximal energy conservation. Kay sa diri nga part bala with the clearance of ground by foot in the swing phase and proper positioning of the foot in the dorsiflexion in the terminal phase. So if ma-imagine nyo, like magapungko kamo da or gahida or gaano man da kamo, if you can imagine the proper positioning of the foot in the dorsiflexion in the terminal swing. So what if Amo ni nga picture. Wait lang. Ari, sa 1, 2, 3, 4, 5, 6, 7. Sa ika-7th nga image, sa 7th nga image, what if, di ba mo ning terminal or mid-swing or terminal swing? So what if hindi niya ma-hold in a dorsiflex nga position? Anong matabo? So tendency i-drag niya ang iya nga, may magka-foot drop siya or i-drag niya kung spastic man siya nga amo na nga position. So tendency niya is i-drag niya ang iya nga foot na lang, 'di ba? Or either ano niya i too much ano niya i-flex niya ang iya nga hip and knee, pataason niya flex ang iya nga hip and knee para nga hindi siya pag i-drag or either i-drag yan na lang or either i-circumduct yan na lang. So ang circumduction ang flexing of the hip and knee in a higher position. So those are compensatory mechanism ng mga patient. So damo ka muna makita sa ulihi sa mga stroke patients bala. Ginadrag na lang nila ila foot. Kaya hindi na nila maalsa or either gina-circumduct na lang nila if naka spastic nga in extended position. Sige. And then, and as ambulatory children with cerebral palsy grow and mature, the abnormal tone and underlying muscle weakness causes skeletal changes that result in abnormal alignment as well as joint structure. So usually, ang ilang gait, multiple gait abnormalities, it's not just one. So, isa gasimpon-simpon na. So here, these are the classic gait patterns and characteristics of the different types ng CP. So first is the diplegic gait. So we will learn, sa adults, we have hemiplegia, spastic hemiparesis, shuffling gait, ataxic gait, foot drop, mga Trendelenburg. So, but with pedia, nga CP, amo lang tani. Let's just stay with the diplegic gait, hemiplegic gait, equinus, and planovalgus, kag jump knee, and recurvatum, and quadriplegic gait. Amo lang ni, let's focus on this one. Ang quadriplegic gait, tapos lang na later. So with the diplegic gait, sige, take 2 minutes to read the, pa rin ko na pagbasahon. Kaya basahon ko man lang siya. Okay, so as you have learned, this can be treated by sa inyong orthopros by ankle foot orthosis, either metal or plastic na mga ankle foot orthosis, and as well as assistive devices with such as Lofstrand nga crutches. So as PT, so amo na itudloan ta sila how to don and doff their their orthosis. We teach them how to do the what you call this, the gait pattern, the correct gait pattern of like 3-point gait or 4-point gait. Dapat saktong alignment ng ilang saktong height and alignment ng ilang crutches, saktong ilang posture while they're doing it para nga hindi sila makapoy. Because if let's say if nakita mo nga sala ang height sa iyang Lofstrand crutches puro wala mo gin correct, so eventually that will lead to another problem na naman. So let's say nagka-back pain siya or nagka-shoulder pain sa muna bala, so we need to correct that one as early as possible. And so here, the generally, ang children with spastic diplegia, most commonly nga makita mo sa with patients with cerebral palsy exhibits with extensor spasm, so ga-extend ang ilang leg, ga-tiptoe or naka plantar flex and nga position, nagka-abductor spasm, and then circumduction, gina-circumduct nila ilaleg. And then sometimes, in some cases, you can also see nga may scissoring gait ang patient. So, how do you assess this one? So, amo na siya i-note nila nga patient has diplegic gait. So, may extensor spasticity. So, with extensor spasticity, hindi na siya ka, hindi na siya ka swing face. Kaya, di ba, with swing face, you need a significant amount of knee flexion or something nga mo na. So, isa-isa ho, nyo gina siya mag-assess ka mo for patients. And then circumduction, again, as I mentioned earlier, ang circumduction, ano siya, ano yung tawag, compensatory mechanism siya. Parang hapos na si iya, bala if the patient cannot do the swing face with flexing his or her leg, so gina-circumduct niya na lang. Parang makita niya na. You can, may mga rin. May picture ko isang may picture isang diplegic gait. Ano picture isang diplegic gait. Ari, again, depende man. So, it's not damo man siya pictures. So, anyway, let's go back. Hmm. Tapos sa hemiplegic gait niyo. So, hemiplegic gait, just imagine, kay do, basi, duli, wala pa kami may nakita nga may hemiplegic gait nga patient. So, nga pediatric patient, but I'm pretty sure may nakita na kamo nga adult na may hemiplegic gait. So, para ma-imagine nyo, amo na lang, imagine nyo na lang nga may adult na may hemiplegic gait. So, so most of them, functional ambulators man. In fact, most of them here are, according to the book, are independent ambulators without an assistive device. So they have abnormalities above the knee and mild increased tone or muscle weakness of non-involved side, since side may not ambulate until 3 years of age. Okay. So mga baka mo hemiplegic gait, usually, again, may amo man na siya to compensate. They do circumduction of foot if hindi enough ang muscle strength niya for the swing face. So, they do circumduction of the, gina-circumduct nilang ilang whole leg. And usually sa leg, sa arms, di ba, flexion, galing kay gate man na istoryahan ta. Pero but anyway, with hemiplegia, di ba, ang usual with hemiplegia is may flexion sa upper E and then may extension spasticity or hypertonia sa lower extremity. So that causes ga-causes ang foot drop or amo na may ano siya plantar flexion nga spasticity. And